Hey there. So for this week's patient, I decided to do it on a 70-year-old male, initials VR, Caucasian. Um, let's see. He came into the clinic. He's a reliable historian. So basically, his chief complaint, the patient came in after being exposed to someone who tested positive to COVID-19. It was related to Thanksgiving and yeah, like a family member just wasn't feeling well and later tested positive for COVID-19. And so um, this patient came in with symptoms similar to COVID-19. So that was his chief complaint, and obviously the exposure to COVID. And so let's see. Yeah, he'd recently been experiencing fever, cough, fatigue, loss of taste, slash smell, and a mild sore throat. Um, yeah, he's up to date with his vaccinations, including his COVID-19 vaccine. Um, so kind of his old carts. The symptoms started 4 days ago. He was exposed to someone who later tested positive, as we kind of already stated. And then, so kind of the location of his symptoms, he obviously has a systemic fever, fatigue. He has cough in the respiratory tract, in the upper respiratory tract, and a loss of taste and smell in the nose and mouth. So the symptoms have been pretty consistent over the past 4 days, lasting throughout the day. Symptoms are slightly worse at night and in the morning, especially some of the coughing. He experiences more during the nighttime. So he's been checking his temperature for the last 3 days. If he isn't taking anything, then his temperature has been typically above 100, ranging from like 103 or 100.3 to 100.9. And with taking Tylenol, it's been helpful. Usually afterwards, it'll come down to 98.9 to 99.5. Cough is consistent throughout the day. States it's more of a dry cough. He noticed the loss of taste when consuming one of his favorite drinks, and he just noticed it like tasted really weird. He actually thought something was wrong with it, and then he got another one, and it was kind of the same thing. And obviously he knew at this point that his family member had been diagnosed with COVID-19. So severity, he feels like it doesn't feel much more intense than like any other, like he was comparing it to either the cold, like a more severe cold, or kind of like the flu-like symptoms. But he said it wasn't more intense than that, and he wasn't experiencing shortness of breath. So yeah, pertinent negatives. Denies feeling short of breath other than just having a cough. And then he's able to complete all of his daily activities without difficulty or shortness of breath. Denies recent travel out of the state or country. Denies confusion, dizziness, nausea, vomiting, cyanosis, angina, chills, conjunctivitis, ear pain, nasal congestion. And then the positives that we kind of already talked about: but cough, exposure to someone with COVID-19, fatigue, febrile, loss of taste and smell, and mild pharyngitis. So review of systems, other than kind of what we talked about. So constitutional, he states he has increased fatigue, intermittent fever, and he has noticed that he's had a few more headaches in the past 4 days than he normally gets. Like usually it's pretty rare that he gets one, but he's had a couple in the past 4 days. So aside from that, nothing remarkable. Aside from what we already had discussed with his review system. Past medical history, nothing super significant for this, but history of osteoarthritis, hypertension, and hyperlipidemia. Like we discussed, up to date with vaccinations, including flu and COVID-19. No applicable surgeries or hospitalizations, no allergies. He's currently taking rosuvastatin 10 milligrams once daily and lisinopril 10 milligrams once daily. Significant family history, cardiovascular disease, both father and grandfather, and then stroke with grandfather. And his father also had hypertension, and yeah, his mother also had a stroke as well. Let's see. He actually is quite healthy. Eats a healthy, well balanced diet, and he exercises 5 to 6 times a week, typically walking, some yoga as well. I think he said 2 to 3 times a week, and he appears to be healthy. And he usually gets about 6 to 8 hours of sleep a night. So his vital signs were normal, aside from his temperature 99.2. And then yeah, his BMI was 21.6, so he's healthy there. So Pertinent Labs, just with his history and everything, we obviously did a PCR, which tested positive for COVID. And then let's see his physical exam. Nothing super significant, other than kind of generally he was coughing. Obviously we were kind of in our full PPE and that, but his lung sounds were actually normal. But yeah, he was coughing, not like super frequently, but every, 5 to 10 minutes, he would kind of cough a little bit and stuff like that. Let's see. But aside from that, yeah, so lungs were clear, heart sounded normal, and yeah, no real significant findings. His throat, a little pharyngeal redness, but no major inflammation of the tonsils. And yeah, that's pretty much the main physical findings. So differentials, I mean, obviously just kind of with some of the symptoms, that the main one we were thinking, which ended up being true, was COVID-19. Also, influenza, the common cold, and then just kind of the worry with really any of those is it can progress to pneumonia. And so just with his clear lung sounds, we didn't feel like that was the case in his situation, at least currently. So the diagnosis came up with was COVID-19. We already did the diagnostic PCR. And then so for treatments, there is the monoclonal antibody infusion, which he technically could be considered for due to his age, but because of the mild nature that he's experiencing, and because he received a COVID vaccine, it actually wasn't recommended for him, at least in this scenario. And then aside from that, we were just kind of focusing on symptom management. I think I failed to mention that he had been using some Tylenol, and he'd been using like Dayquil and NyQuil just to help, a little bit with some of the secretions, and yeah, kind of some of the a little bit of the mild sore throat. But we let him know that he can continue the Tylenol, so 650 milligrams every 4 to 6 hours, or 1,000 milligrams every 6 hours, just not to exceed 4 grams per day. And then we also told him that he can use the over-the-counter cough suppressant, dextromethorphan, 20 milligrams every 4 hours. And then education. So we told him to quarantine 14 days after the onset of symptoms, or until negative tests with no associated symptoms. And that was the recommendation by the CDC. And then also some of the recommendations: at night, he can, kind of like they do in the hospital, he can prone himself, just to kind of help the secretions, hopefully alleviate some of the coughing spells and that, and in addition to the over-the-counter cough medication. And then breathing exercises with, just inhale, exhale. We educated him about those, and provided him with a handout. And then also just educated him to stay well hydrated, and to get adequate rest to help the body recover. And then obviously if he's having severe difficulty breathing, or if symptoms are getting worse, that he, especially if he's in acute distress, that he needs to go to the emergency department. So we followed up with the patient 48 hours after his visit, and just seeing, how he's doing, to hopefully, that he's progressing, improving. And he is starting to feel a little bit better. Cough is actually dying down. And then we did mention that we could possibly prescribe him benzenate, 100 milligrams if needed, but he said he was actually doing pretty good. So um, we will also probably follow up with him in the next couple of weeks, just again to make sure he's doing okay. But that's kind of the gist of it. Thank you for your time.